This is David Holt, IV consultant. Today's subject is nursing malpractice. If you are sued for malpractice due to calculating drug doses incorrectly or failure to give a full dose of IV antibiotics, for instance, are you going to blame yourself, or are you going to try to put the blame on your lack of teaching? Now, as far as teaching us how to give full doses of IV antibiotics, that generally does not happen. The teachers at nursing schools, the textbooks, IV infusion, Nurses Society textbooks, IV therapy textbooks, nursing policies at our hospitals, and nursing orientations, they all, for the most part, fail to teach us how to give a full dose of IV antibiotics. Now, my 4 books and websites show anyone who cares to read them how to give a full dose of IV antibiotics, or magnesium, or venifer. And there's also a page on the website to help the public learn how to make sure that they get a full dose. So you're in the courtroom and the attorney is asking you questions. Why, Miss Nurse, Mr. Nurse, did you only give half a dose of IV antibiotics? Well, your standard response may well be, that's how I was taught how to do it in nursing school. And that is exactly the response that I get from most nurses that I try to teach how to give a full dose of antibiotics. However, in the courtroom, if you have a halfway decent prosecutor, they will bring in an IV setup and they will use my death or die example from my website, and they will put some dye into a 50cc bag, and they will ask you to program the IV pump to give a full dose of antibiotics. And typically you, just like the pre-programming on an IV pump, you will program that pump for 50 cc's. And when the pump alarms, you will demonstrate to everybody in the court, including that 12 special people in the jury, that when the pump alarms, you disconnect and you switch off the pump. And lo and behold, the prosecutor will show you 5 cc's of dyed liquid in the bag and the IV tubing still full of the fake antibiotic. He or she will have proven the case, and you are at risk of losing your license and your job, and it's unlikely that your employer will back you up and say, oh, it's not our fault. Sorry, the employer will not say, oh, it's our fault for not teaching them. Well, the hospital is going to have a deeper pocket and a higher malpractice insurance, and may well take over the fee paying for your lawsuit. But in all probability, they will deny responsibility, and you as a nurse are 100% responsible to give the full dose of antibiotics, and it is your license, it is your job that is on the line. So please learn how to do it properly and stay out of court.